Hi, I'm Gill Stannard. I'm a naturopath and mentor, and I've got something very special to talk to today to cover a subject and condition that I think very few members of the public or even part of my naturopathic profession are aware of. So, like you meet Kath Cornthwaite, who is a cancer survivor and a bowel cancer research nurse in Adelaide. And Kath's got a bit of skin in the game. So, thanks for being here, Kath.
Thank you for having me.
So, what we're going to talk about today is Lynch syndrome. What is Lynch syndrome?
Well, Lynch syndrome is not really a syndrome, but it's an inherited mutation in different genes of the mismatch repair complex. It's a bit like a spelling mistake in your genes, in the genetic code. And it just, if you've got this gene, it just predisposes you from an increased risk of getting different types of cancers. There's quite a few different cancers at a younger age.
So it's something that runs in families, like the BRCA gene.
Go say a bit more about that?
Yeah, go for it. Because I know there's quite a few cancers involved. At first, they kind of didn't think there was many, but it seems to be growing. Go for it.
Yes, there's about 12 different types of cancers that you've got a risk of with Lynch syndrome. With BRCA, that's quite similar, but it's mainly breast and ovarian, and it's mainly the women, although some men can carry it as well. But Lynch syndrome, mainly a risk of colorectal cancer, so bowel cancer. There's an 80% risk of getting bowel cancer if you've got the gene, and also uterine and ovarian cancer in women. You've got a 40 to 60% risk of having those sort of cancers. And there's also others like pancreas, small bowel, esophageal, brain, skin, there's kidney, there's quite a few other different types of cancers, but it does depend on your mutation. There's 4 main mutations, which is MLH1, MSH2, MSH6 and PMS2. So they're the 4 main categories, but there are some other little ones. So it depends on which one you've got to your risk profile and also your family history.
Okay, so different genetic variations predispose you to different types of cancers.
Yeah, different
risks for that Lynch family of cancers. Okay, That's really fascinating. So, if you were diagnosed, we're going to get to your diagnosis soon, but if you're diagnosed with Lynch and say you're a parent or thinking about becoming a parent, what's the stats on you passing it on to a child?
If you find out you do have genetic risk of having Lynch syndrome, and you've got a 50% chance of passing it down to your children. So it's really important that you know.
Yeah.
When I was diagnosed with having Lynch, 8 years prior, I'd had ovarian and uterine cancer. But little did I know that my grandmother had it, but no one told me or no one thought it was important. So,
Wow, so it was a really long gap between your cancer diagnosis and exploring the Lynch pathway. So can you tell me a bit more about your story?
Well, we always knew in our family we had a strong link to bowel cancer. So we did have that knowledge. So my father had bowel cancer a few times, and he knew his mum had bowel cancer, and it sort of went through his family and his sisters and brothers. And it wasn't until my cousin in South Africa at 40 got bowel cancer that he had genetic testing. So he got found to have Lynch syndrome, and then we started looking at the other cancers that was involved with this, and then realised that my cancer was actually a Lynch syndrome cancer. And these cancers actually behave a bit differently. So my tumour behaved differently to a normal ovarian cancer tumour. And also the treatment is different for them. But then we started really looking at the different types of cancers in our extended family and who might be at risk.
And what's the kind of spread been in your own family then?
Sorry?
How many family members have you identified so far about as having Lynch?
Oh, well, first we went through where it would have come from. So it definitely came from my grandmother, who was French. So we call that the French connection. And then we went down to my father's siblings, and he was one of 5, and 3 out of 5 were found to have the genetic predisposition. And then we looked at their families, and we looked at their children, and to just work out who was at risk and who wasn't, because if you know you're at risk, you have to have extra screening. But if you know that you're not at risk and you don't have the gene, you don't need that screening. So I have 3 boys, and 2 out of 3 of those have the gene. And my sister, I'm one of 4 children, so it was 2 out of 4 of us. We discovered we had them, and so we're checking our children. And it's really important when my children have children that they do know this information.
You know, has there been some resistance from some members of the family who just don't want to know?
Yes, there has. There's always that one or a few people that say, oh, I don't really need to know, I don't want to know. But one of my boys, he's not tested, so we're not sure if he's positive or not. There's a chance that he'd be negative because the other 2 are positive, but you know, each child has a 50% chance. So
yes.
But you know, he's married to a nurse, so I'm just leaving that up to her to help. But when they have children, that's when I think it will become really important to know this information.
So psychological things aside, because you know, some people are phobic about cancer and don't want to talk about cancer, don't want to know about cancer. Are there any other disadvantages to being tested?
Disadvantages.
Well, for example, is it going to impact insurances, like your health insurance, or if you've got life insurance or anything like that?
I think a cancer diagnosis definitely affects your insurance. Insurance companies are not usually keen to take on a new person who's had a diagnosis of cancer. If you've got a genetic risk, some insurance companies do put extra sort of issues in your path if you want to get insurance. But we are trying to go through the government to try and change those sort of pre-existing ideas that if you know you've got a cancer predisposition, then you're definitely going to get cancer. I think the advantage of knowing you've got the risk is that it means that you can actually do something about it and minimize your risk. Because if you didn't know, then you wouldn't be able to make lifestyle changes.
So what is some of that screening process, and how frequently, or is it entirely based on what variant of the gene you've inherited?
That's correct. In my family, we follow a certain pattern. It's more bowel cancer at the age of in the 40s, and then in the 70s. Specific types of cancers in our family. Different other families have different cancer risks, and it also depends on your profile. So bowel cancer is quite easy to screen for. So when you've got Lynch syndrome, you need to start screening a lot earlier, in your 20s. That's usually, rule of thumb is 10 years before the youngest person. So in our family, my cousin got it at 40, so we start screening at 30. But even some people screen a lot earlier if you do have Lynch syndrome. So bowel cancer is one, also esophageal and upper GI tract cancers. And the gynecological cancers, it's just good to be aware of the symptoms, because often there's not much screening. So if I realised my risk with ovarian and uterine, I would have sort of done something about my symptoms a lot earlier, because I just thought I was lactose intolerant, or a bit of bloating, and so I wasn't really sure.
And we'll just do a little bit of ovarian cancer awareness and chuck in what people usually throw out there as symptoms, but it's different in every person. It can be you feel uncomfortably full, eating or drinking small amounts feels uncomfortable, you might need to wee more, your bowel habits may change. If you're still menstruating, your cycle could change, or you could even have your belly sticking out and looks a bit pregnant rather than coming and going every time you have a bowel motion. It might stick out. Can you think of any more in the ovarian cancer club there?
Yes, I think I had a lot of those. Yes, definitely the feeling of fullness was the strange one, which I had no idea was a symptom of ovarian cancer. And the bloating and that sort of thing. My tumour got quite large, and that's the Lynch tumours do get quite large with ovarian cancer. So I guess that really did help my diagnosis and helped me with a better prognosis as well.
So could I just say you're a bit special, because because you had what's known as synchronous tumours.
Yes.
Is that correct? Yeah. Would you just explain a little bit about that, because it is pretty special. I've only come across one other person so far.
I don't want to be specially known for that, but yes, it is quite unusual. They found a uterine cancer as well as ovarian, and if I hadn't had the ovarian cancer diagnosed, maybe I wouldn't have even known about the endometrial.
So two primary tumours, not a primary and a secondary, two popped up at the same time, at the same stage or a similar stage. Yeah.
Yes.
So that's pretty amazing. So if somebody's sitting there thinking, there's a bit of bowel cancer in my family, or somebody had endometrial cancer or esophageal cancer or whatever else, what should they do first if they suspect?
The difficult thing is linking all these cancers to one gene. Most doctors or specialists you go to, they like to look at their own little area. So the bowel cancer people will look at the bowel cancer, and the gynecological people will look at the gynae things. And so I think the difficulty identifying people with Lynch syndrome is due to the fact that it crosses so many different specialities, and they don't really talk to each other, all these specialists. So looking at your family history is the most important thing you can do. I think it comes with difficulties, because a lot of generations don't share what's happened to their grandma or great grandma, or no one really knows, and families are spread all around the world and often a bit disconnected. So, yeah, the important thing is finding out your family medical history.
And then I've heard there's a calculator you can go to, which maybe we can I'll put in the notes when I put this up on YouTube, which is not 100% though, but it gives you a little, you can pour in what you do know, but even if you still have a strong gut feeling, even if you feel your scores are lower than you should be concerned about, who do you then go to if you suspect there's something that needs to be investigated, if you want to know?
Yes, the little calculator that's been developed is quite useful, just a bit of a quick check. But the best person you can talk to is probably your GP in the first instance, who may or may not know about Lynch syndrome, and that's the problem. If someone in your family has had a cancer diagnosis, it's really important to maybe find out what those cancers are, find out your family history, take all that information to your GP, and then get a referral to a geneticist. The best way to actually confirm if you've got Lynch syndrome is through a blood test, through a genetic unit, and they do genetic sequencing, and they can pick up any genes there. There are criteria you need to meet, but just finding out that criteria is important and worthwhile.
So there's some counselling involved. So you talk to a counsellor as part of that process. And in Australia, if you meet the criteria, do you have to pay for that test, or is it free under Medicare?
If you meet the criteria and they can see there's definitely a link there, then it's free.
Yeah.
You can also, if you're worried and a bit concerned and just really would like to know and you don't quite fit the criteria, because it doesn't always pick up everyone, you can pay.
Yeah.
So that's what you can do. There's another stream that you can go on if someone has had a cancer diagnosis and you do have a family history. You can see if you can get that person fast-tracked through a blood test and just some quick genetic counselling. And if that person comes back positive, then they get the full counselling. So that's a new mainstreaming path you can go down if you've actually got a biopsy.
And of course, there are people who don't know their family history. They might be estranged, they might be adopted, or as we keep seeing through all those those family DNA program, things that people discover that their father wasn't their father, or that sort of thing. So, I always think a bit of following your gut is important, because sometimes we don't know. We think we know our history, but we don't know our history. And certainly, with the odds that you gave at the beginning of the video being so high for some of these known cancers, being detected early, which is my story, and to certainly say your story, being detected early is your best chance of surviving these cancers. And as you work specifically in the bowel cancer realm, I quite commonly come across this with clients once they've hit 50, so 50, 51, I say, did you get your bowel screening kit? And so many people don't do it. It's a bit icky because it deals with poo, and it's a bit like, I don't think I've got it, so I don't need to do it. But it's, really, we are so fortunate in Australia that we have this free screening service.
Absolutely. It's so important. Even when I first started with the Bowel Health Service in Adelaide, they made me, even though I was having colonoscopies every year, they made me do one of these little home store kits. And once you've done one, it's super, super easy. Yes. It's just the thought of actually doing one, which is a bit of a problem. Yeah. But it picks up so many cancers early, and that's the main thing. And we're seeing so many young people with cancer these days. It's it's surprising, but
so what do you classify as young? What's young?
Or late teens, 20s.
Wow.
Yes.
So I think that's a good thing to realise too, apart from if you have the Lynch gene or one of the genes, and it makes you more likely to have this, but also at a younger age, that, even if you don't know your family history and your gut's not right, try not to get fobbed off. I'm going to say from my profession here, it's not always SIBO, it's not always the microbiome. Actually, there are times when you need to skip to the colonoscopy and just to get some clarity around then.
Absolutely. Too many doctors are saying you're too young to have bowel cancer, so it couldn't be that, and that's when things get delayed. So yes, definitely colonoscopy is the gold standard for bowel cancer, that's for sure.
Is there anything else about Lynch or your story that you'd like to share that you think people should know?
Just that so many people are walking around not knowing they have this risk. One in 280 people are supposed to have this genetic predisposition, and only 90% are identified at the moment. So
90%. So there's 10% who don't suspect. There's 10% who don't know.
10% who know.
Oh,
and
sorry,
the
it's the
rest
other way around. So 10%
don't
know,
know.
90% don't know.
Yes, a lot of
Whoa.
people. And my family, we didn't know anything about 8 years ago.
Yeah.
And now we know, oh God, I haven't really counted everybody, but there's at least 15 people in our family who now know they've got the gene. So you just identify one person in the family and you find lots of others.
Random question. You mentioned before about the French connection, it's kind of jokingly, but do you know if different ethnicities are more likely to have Lynch? Is there any research you're aware of around that?
Well, from my understanding, a lot of families originate from Ireland and Europe, England, so a lot around that area. And I guess people are just spread to lots of different countries. So yes.
So I'm guessing it's no accident then that it's Lynch. Lynch is such an Irish name, isn't it?
Yes.
happened to be a Lynch who discovered it. So and talking in places like Australia and New Zealand, having some Irish ancestry or British ancestry is pretty high. So it's something that definitely is embedded in Australian society. That was really fascinating, Kath. I mean, I was going to cheekily say, when if you go to a GP who's never heard of it, just show them the video. They can just take this through, give them the link to the video, and they can watch it.
That's right.
And I know often when we're exposed to new information, speaking as a practitioner, we kind of go away and we think everybody's got it. I've got to say, since I've got to know you and heard about Lynch, I think about this much more frequently, and really, really interested in the family history side. And let's hope we can change those statistics. So it's going to be 90% of people instead of 10% of people who have the gene who can identify it. Yeah. Thank you so much for sharing your time today. I'm going to put some links down below for people and ask people if you somebody's just interested in health or you're a practitioner, could you just do that magic thing of liking and subscribing and perhaps even hitting the notification bell if you'd like to see more videos about this. So I will give you links below and I will see you next time. Thanks so much, Kath.
Welcome.